Okay, this is a lecture called Biological Basis of Behavior, Part 1. And this is for Psych 101 with Dr. Moses. So first we're going to start by talking about a little bit about what a neuropsychologist is. So neuropsychologists explore the relationship between brain and the nervous systems and behavior. Neuropsychologists are also called biological psychologists or biopsychologists, behavioral geneticists, physiological psychologists, and behavioral neuroscientists. It is a great field to go into. There's good money in the field. You do a lot of testing of individuals who are having difficulties to try to figure out what areas of the brain may have been injured, and give recommendations on how to have that person adapt better in their day-to-day life. So for example, in the military, I worked with a man who had worked as a gunner. He would be in an airplane where there were like cannons on the gun, and he would repetitively be around these blasts, these big cannon blasts out of the airplane. So not only in real life world situations, but also in practice, he would be around all these repetitive blasts. And when he came to me, he was having some cognitive, difficulties. His speech, at times he'd find himself slurring words. There was some difficulties with him with balance, like when he was walking and he would turn a corner, he would kind of get off balance. So my job in that situation was to do some testing on him to try to figure out whether he had a traumatic brain injury from the repetitive blasts of the cannons. Okay? And then through that testing, I'm able to kind of pinpoint which area of the brain may have been injured during the blast, if there is an injury. And so that's an example of something a neuropsychologist may do. So consciousness, right, that's your awareness of the outside world and yourself, including your own mental processes, thoughts, feelings, and perceptions. Your consciousness is selective, subjective, and unique to you. It's always changing, and it's central to your sense of self. Right? We're going to talk a little bit more about perceptions and these pieces of your consciousness as we go through the course. But for right now, just try to wrap your head around your basic understanding of what I just said. Right? Your consciousness is unique to your sense of self, and it's unique to you. Right? You only see what you see. There's other things happening that you may not be perceiving. The way you perceive the color red may be different than the person sitting next to you and the way they perceive the color red, right? Your perception of an event, if a dog walks in the room, you may perceive that as a threat, where the next man might not perceive that as a threat, right? So all of this is in your consciousness. It's your awareness of the outside world and yourself. Okay, so you are going to be watching a little video about Phineas Gage as part of this week's assignment. So in the concept section of our course, you'll see a little video explaining a little bit more about Phineas Gage than I'm about to tell you. But let's start off by saying that the way we know a lot about the brain is through a couple of methods, but it basically started with brain injuries, right? So we started to understand that this part of the brain or that part of the brain had this function or that function because someone would be injured in a certain area of the brain and something would change about them, something would be different, and we started to gather that evidence to try to see if this guy has an injury in the back of his brain and that guy has an injury in the back of his brain, and the same kind of loss of function happens, then we know that that part of the brain
has that function, right? So as technology has advanced, scientists have used a wide range of techniques to learn about the brain and neural function. But like I said, over 150 years ago, studying patients with brain damage linked the loss of structure with the loss of function. Phineas Gage there in the left bottom corner. This story is from 1848. He was a very level-headed, calm foreman of a railroad crew. And then there was an explosion which hurled an iron rod through his head. You could see that it went through his cheek and up through that front part of his head. Okay, so it went through what we call the frontal cortex of his brain. It went through, it severed these connections between the limbic system of the body and the frontal cortex. So his personality changed drastically after this injury. Gage became hostile, impulsive, and unable to control his emotions or his obscene language. So observed at autopsy, I mean, he lived through the injury. He survived the injury. You could see him on the right? But after he passed away, at autopsy, his loss of tissue, where that limbic system is connected to the frontal lobes, revealed the relationship between the frontal lobes and the control of emotional behavior. So we started to understand that that frontal lobe, that you're going to see there's 4 lobes of the brain. There's the frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. And his injury in the frontal lobe caused such an emotional change that we then understood that that's an important emotional center of the brain. The second bullet point talks about Broca's area, right? So who is Broca? There was a man just shortly after Phineas Gage. So we're talking about 1861 now. His name was Paul Broca. He performed an autopsy on the brain of a patient nicknamed Tan, who had lost the capacity to speak. He could not speak anymore, right? So although his mouth worked, right, he had the ability to open his mouth, close his mouth, he had a tongue, right? His vocal cords were not damaged, and he could still understand language. It's just he could not speak, right? So Tan's brain showed deterioration of part of the frontal lobe of the left cerebral hemisphere. So we divide the brain into 2 halves, 2 hemispheres. There's the left half of the brain and the right half of the brain, the left hemisphere and the right hemisphere. So his injury, or that deterioration, right, it was in the frontal lobe, that front part of the brain, sort of like where Phineas Gage was, right? But it was in that left half of the brain, okay? So what they did is they noticed that damage there, and also his loss of function, which was the ability to speak, not only showed up in his brain, but then they started to gather more evidence of injuries from other people who also had the inability to speak, looked at their brains, and saw that damage in that same area. That left hemisphere, left is very important. You need to know that location. The left hemisphere, the left half of the brain, and the frontal lobe. They started to they started to recognize that was the area for expressive language, right? So Broca's area, which you could see labeled kind of in that purple color in the diagram, Broca's area is connected to the loss of the ability to speak, which is known as expressive aphasia, right? So if you're a psychologist or a neuropsychologist and you have a patient who suddenly has an inability to speak, you've got to rule out different things, and there's different tests that you would do. And you would conclude, possibly after doing those tests, that there may be damage or deterioration in Broca's area of the brain. The next bullet point is Wernicke's area. Okay? And this is where we have not expressive aphasia, but receptive aphasia. So somebody who has damage to Wernicke's area, they can probably speak just fine, right? They have the ability to say words, but their ability to receive words has lost some function, right? So their ability to someone speaking to them and for them to then process that and receive it by the brain is is going to be affected. So his name was Carl Wernicke. He found another brain area that was involved in understanding language, and that's in the left temporal lobe. Okay, so in the left hemisphere, it's not in the right hemisphere, in the left hemisphere, the left half of the brain, in the temporal lobe. Again, we have the frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. We divide the brain into 4 lobes, right? So in the left temporal lobe, the left side in the temporal lobe is Wernicke's area, right? And you can see that little area. It's kind of like almost above the ear, a little bit towards the back of the brain. That is destruction of Wernicke's area results in the loss of the ability to comprehend written and spoken language. So that's receptive aphasia. So you might become a school psychologist or work with young children, and you might have somebody having learning difficulties in school. And one of the things you may have to kind of rule out or test for is their ability to receive language and comprehend language, that receptive part of language. And you might suspect in certain cases some damage to that area of the brain. So gunshot wounds, tumors, strokes, and other diseases that destroy brain tissue, that helped us map further what functions different parts of the brain have. But because the study of the brain through injury was a very slow process, you had to wait for someone to be injured, right? You couldn't just base it off of one guy, right? You had to like have multiple cases to prove your point that area has that function. They started to get a little bit more, do some riskier things to try to figure out what happens when you damage a certain part of the brain. So lesions are when you're doing a precise destruction of brain tissue. So they started to do that to lead to a more systematic study of the loss of function resulting from surgical removal. So they would cut neural connections, they destroy chemical applications, they do some sort of surgery to get rid of a piece of the brain and then see what loss of function there was. If you see that next bullet, corpus callosum, okay, in the bottom right corner, you'll actually see kind of a bird's eye view of where the corpus callosum is. It's that strip through the middle of the brain. So we see there's the left half of the brain and the right half of the brain, right? And it's connected by this fiber of tissues called the corpus callosum. In the bottom middle image, you'll actually see the corpus callosum from a couple other views. So you can see kind of the size of it and where it's located if you're looking from a side view or from the back view. But the view you see over, again, on the right kind of shows, I think, a good way of showing the two sides of the brain being connected. So if information comes into the right side of the brain, the corpus callosum actually helps transfer that information over to the left side of the brain. And if information comes into the left side of the brain, it actually transfers information over to the right side of the brain, right? So maybe something coming in through your eyeball on one side of the brain, it needs to be processed on the left side of the brain. Like, it's important information for the left side of the brain to know, but the right side of the brain also needs to know it, and the corpus callosum is important for that. However, there's some people that have seizures, and there's a particular type of seizure called a grand mal seizure, which could be very, troublesome, bothersome, dangerous, right? Someone could be walking and just all of a sudden they can have a seizure, right? So one of the ways they would remedy the problem of these seizures is to remove the corpus callosum from the brain so that they could not have as kind of explosive of a seizure, right? So to relieve to relieve kind of the neural connections there, they would cut and sever the corpus callosum between the hemispheres, right? Between the halves. Studies by Roger Sperry and Michael Gazzaniga of patients with these split brains, right? So their brains are kind of like, it's almost like they have two brains now instead of one, because the corpus callosum's not there after they split it to keep it connected, right? They've revealed that the left and right hemispheres do not perform exactly the same functions. Okay, so by splitting it, we started to understand that although like the frontal, they kind of look like they're matching halves, right? We started to realize that there's actually brain lateralization, right? So brain lateralization means that one hemisphere specializes in one thing, the other hemisphere specializes in another thing. You are going to actually watch some videos this week in the content area about split brain patients that I'd like you to watch to further understand this. But the left cerebral hemisphere, we now know, specializes in verbal, mathematical, and analytical functions. And the nonverbal right hemisphere, the right is nonverbal, remember? So if you remember verbal, right, that's Wernicke's area, Broca's area, that whole verbal area is in the left side of the brain. But the nonverbal right half, or right hemisphere, is specialized for spatial, music, and holistic functions such as identifying faces and recognizing emotional facial expressions. So imagine you've got no corpus callosum, there's nothing in the middle, and you've got one side of your brain that's supposed to recognize faces and emotions, and another side of the brain that's supposed to be able to express language. And what does that look like? Are you able to, if the information for recognizing a person's face comes in through one hemisphere, but the other hemisphere is responsible for expressing language or receiving language, what does that person with a split brain look like? How do they function? What is the difference between how they function and how you function? Okay. Past these ways of looking at injuries and creating lesions and performing surgeries, they've also done some direct electrical stimulation of different cortical areas of the brain. So actually just taking a tool and just pressing and prodding inside the brain, when they stimulate different cortical areas of the brain during surgery, it has helped scientists to observe the results. So if you stimulate the back of the frontal cortex, so sort of that area that we're talking about with Phineas Gage, that area, that frontal part, if we stimulate that part of the brain at particular sites, it causes body movements for different body parts. So we started to understand that that's part of the motor cortex, right? So the motor cortex is a part that like causes movements in your body, right? So they understood that by pressing down and stimulating it electrically during surgeries, right? So electrical stimulation. There on the next bullet is brain imaging technologies chart, which I included in your content area this week. That shows the difference between a CT or CAT, a PET scan, an EEG, and an fMRI. And you can further see that those technologies have different uses and benefits, and they also have some limitations as to what you can actually see in the imaging. So you might be ordered by your physician to get a CT scan versus an fMRI, and you can kind of see where their decision making might come from as to what they're trying to look for. Some imaging doesn't give you as much detail as other imaging, and so you might not be able to see. So, for example, with the guy I was talking about earlier, the gunner with the cannons on the side of the plane, they did an fMRI on his brain, but the imaging of that particular fMRI didn't show us really much of anything we needed a higher, a higher fMRI to be performed to really even see if we could find any damage using that method. So our best method at that moment was to do other kinds of testing to kind of rule out whether he was having, whether it was a traumatic brain injury or whether he was making it up completely, right? We can't assume that what he's saying is actually true, but we have ways of figuring that out in neuropsychology. This is the end of the video. There will be a part 2 coming very soon.